PPCR, hello Group 3 randomizers. I'm gonna present a meta-analysis regarding one of my fields. I am an internal medicine physician. I work as an assistant program director for an internal medicine program in Santo Domingo, Dominican Republic, and I also work in the ER department. So I'm going to bring to you a meta-analysis from radiology. It's titled Frequency of Acute Kidney Injury Following an Intravenous Contrast Medium Administration. This is a systematic review meta-analysis. Um, First, I would want to talk about first the importance of doing contrast. Um, the issue is here that most of our field for the diagnosis of pathologies, we need to administer contrast. It really helps and improves our diagnostic yield. So, the main issue here is that we are afraid of contrast and what it can do to the kidney. So, it can produce acute kidney injury. So, we limit a lot of our contrast to patients because of our afraid that they may develop acute kidney injury. This comes from data, pretty old data from intravenous intra-arterial contrast that was done for arteriography and myocardial infarction. So this is quite different because the contrast we use now is also has a lower or smaller weight than before, and it tends to produce less injury to the kidney. And also we use it more for diagnostic purpose is venous contrast, not arterial. So there's a lot of data of higher, smaller intra-arterial contrast that produce a lot of kidney injury in the past. So this systematic review was to report the incidence of acute kidney injury after the administration of intravenous contrast on patients who undergo imaging. And the main database that they use Medline, Embase, Scopus, and Concrete Library from published data up until September 2011. This article was published in 2013. The PCOT was population individual undergoing contrast imaging. The intervention was imaging with contrast, and the control was patients that wasn't used contrast material, and the outcome was those who developed acute kidney injury. Um, the thing is that most of our kidney injury that we're seeing now probably is not related to contrast. Is because of other factors that are probably confounding, and we're thinking that the injury related to contrast is more than we thought it was. So this is an excellent meta-analysis that will help us clarify this. So the effect size they used in this article was a relative risk because we had a dichotomous outcome was acute kidney injury or no acute kidney injury. So we're gonna see in more detail this later on. So the study selection, they searched and there were potentially 1,489. They excluded 1,441, and the article that was for tech review were 48. Some or other 35 were excluded because they use intra-arterial contrast that we're preferably want to use intravenous because we know it will be less effect. So most of our scope of imaging is intravenous. Rarely we use intra-arterial. Other was excluded 6 because they didn't have a control group. Other didn't have AKI measurement, and other meta-analysis, and gadolinium. Gadolinium is a contrast material that's used in MRI. And they found out that 13 articles um, fulfill the inclusion and exclusion criteria. They mentioned heterogeneity with an I square, and they mentioned that it was between 34 and 65 that it gives it a mother heterogeneity. These are some of the articles. I'm not gonna go full on all of them, but for example, the first one from Aulich et al. In 2010, and they use patients with stroke, those who were gonna get ATPA, and those who didn't. They compare with that group. They had 164 patients, median age 70, and some other factors that were present here. We see that most of them had 164, 65 patients, 194, one had 6,964 patients, and it was for some numerous of reasons. For example, Kramer for inpatients undergoing contrast of head CT, others in the ED, patients undergoing contracts, and they were pretty the same. The match control and who received contrast and those who didn't. The first one, for example, the number of patients was 81, median age in both groups was 56. The percentage of female pretty accurate as well. Creatinine levels also the same, and that goes on for most of the groups. Pretty equal groups. They performed a sensitivity analysis. They didn't include the graph, but they did mention that they performed to exclude the study with the largest relative weight, and the estimates were based on a random effects model. And the relative risk of acute kidney injury wasn't unchanged regarding the even though they didn't improve the graph, they mentioned that if you remove some of the study, the net effect was the same. So I would have preferred to see the graphs so I can have better evidence of this, but it wasn't available. They search for publication bias and they use a funnel plot analysis. I'm gonna go ahead and show it to you guys. They didn't include it in the article. I had to perform in the supplementary appendix and find it. And the funnel plot did not demonstrate any publication bias. They also did an error test that showed a p-value of 0.76 is higher than 0.005, so it excludes any publication bias. This is the funnel plot. We see that it's equally distributed, and they use a log risk ratio, and we don't see a lot of studies on the bottom that could mean that probably a smaller study weren't present, but for the sake of summary, it was pretty equal. The results of these 13 non-randomized trials were 25,000 patients. The main point here was the group that received contrast material, the risk of AKI. As you see, the relative risk was 0.39, meaning that those who received contrast had lower risk of acute kidney injury. It's a surprise. The confidence interval here is for 95% is between 0.55 and 1.67 with a p-value of 87. It crosses 1, so it's not statistically significant, and the main thing is that we're not seeing a higher incidence of acute kidney injury in patients that are receiving intravenous contrast. So this is a quite important finding because it tells us that we are probably excluding a lot of patients of not using intravenous contrast because of afraid of their probably having acute kidney injury, but in fact they're having acute kidney injury from other causes, and this can sometimes be life-changing because it restricts a lot of patients from having procedures, just like thrombolysis in a acute pulmonary embolism or acute stroke of not benefiting. Other parameters that they analyzed with dialysis and they were not statistically significant. So the conclusion was that controlled contrast medium induced nephropathy studies demonstrated a similar incidence of acute kidney injury, dialysis, and death between contrast medium groups and non-group. I prefer the term contrast associated nephropathy, not induced, because there's no clear evidence that this is happening. So this is my meta-analysis. I hope you guys liked it, and if you have any question, please feel free to ask me in the comments.